Imagine if someone looked at you today and told you the most statistically likely ways your body will begin to change after 60. Would you want to know? Most people say yes, but then spend years ignoring the exact information that could prevent it. There is one piece of data you have had since birth that is highly underused in predicting age-related risks: your blood type. Not in the way diet books or wellness trends describe it, but in the way epidemiological research shows it affects your cardiovascular system, brain function, immune response, and your most likely vulnerabilities if not addressed early. Today, we'll go through every blood type, O, A, B, and AB, and reveal what you need to know for prevention and longevity. Type O is the most common blood type, present in roughly 45% of people. Historically, it was an advantage for survival, supporting endurance, immunity, and protein digestion. For people over 60, type O carries lower levels of clotting factors, meaning smoother blood flow and lower risk of heart attacks and strokes. However, this advantage can be deceptive. Type O individuals often neglect digestive and joint health, even while feeling protected cardiovascularly. The stomach lining of type O is more susceptible to Helicobacter pylori, which can lead to chronic gastritis, ulcers, and in some cases, gastric cancer. If you are type O and over 55, testing for H. pylori is essential. Protect your gut with fermented foods like kefir, miso, and kimchi. Limit NSAID use unless necessary, and maintain daily movement with walking and resistance training to balance metabolism and stress. Cardiovascular strength is your inheritance. Your stomach is your responsibility. Type A emerged with agricultural populations and developed strong immune responses, especially against viral infections. This works in youth but becomes a risk by 60 due to higher platelet stickiness and elevated cortisol. Chronic cortisol combined with active coagulation inflames arterial walls and increases cardiovascular risk. For type A, stress management is crucial. Monitor blood pressure, consider homocysteine testing, and ensure sufficient folate, B12, and B6 intake through leafy greens, legumes, and lean proteins. Implement daily cortisol reset practices, such as diaphragmatic breathing for 10 minutes every morning to maintain cardiovascular health. Type B evolved among nomadic populations and has remarkable metabolic flexibility. It can handle a wide range of dietary inputs without triggering inflammation as easily as other blood types. However, type B carries a unique immune profile, and certain foods like refined seed oils, processed foods, and high fructose corn syrup can trigger systemic inflammation. For type B, maintaining low baseline inflammation through diet, movement, and regular C-reactive protein monitoring is critical. Exercise should be moderate and consistent, favoring cycling, swimming, hiking, and walking. Autoimmune screening should be considered if symptoms arise. Type AB is the youngest blood type and carries a dual inheritance of immune tolerance from both A and B. It is generally less inflammatory in the gut, but carries higher cerebrovascular risk. Type AB individuals have elevated coagulation factors and microvascular changes in the brain that increase vulnerability to cognitive decline and vascular dementia. For type AB, protecting brain and cardiovascular health is one and the same. Regular sleep of 7 to 8 hours, consuming DHA from fatty fish or supplements, controlling blood pressure and blood sugar, and cognitive engagement are essential daily interventions. Finally, the Rh factor, positive or negative, affects immune signaling. Rh-negative individuals may have heightened sensitivity to inflammatory triggers and should adhere even more rigorously to anti-inflammatory and preventive protocols. Women who are Rh-negative must consider Rh compatibility if pregnant. Knowing your full blood type, including the Rh factor, and sharing it with your physician is critical. The key point is this: your blood type is not a sentence, it is a map. Genetics set the stage, but daily choices fill in the details. People who understand their biology and act proactively, sleeping well, eating appropriately, managing stress, and monitoring key markers, can dramatically reduce risk and maintain health decades beyond what would otherwise be expected. Your health is influenced by your blood type, but your choices determine the outcome. Understanding this allows you to take control, prevent complications, and age with strength and resilience. Knowing your blood type and Rh factor is the foundation, but the next step is action. Regardless of type, daily habits dramatically shape outcomes. Type-specific nutrition, stress management, sleep, and movement combine with regular health monitoring to prevent age-related decline. Screening for silent issues like H. pylori for type O or homocysteine and cortisol management for type A is proactive medicine. For type B, keeping inflammation low and maintaining a balanced gut microbiome is vital. For type AB, protecting both brain and cardiovascular health simultaneously is non-negotiable. Blood type knowledge allows you to tailor your lifestyle precisely. It is not fear, it is foresight. For example, a type O individual walking daily, eating fermented foods, and managing digestive stress actively protects the stomach. Type A uses stress reduction and nutrient support to counteract sticky platelets and cortisol impact. Type B optimizes diet and moderate exercise to regulate systemic inflammation. Type AB focuses on sleep, DHA intake, and cognitive engagement to maintain neural perfusion and vascular health. These are not optional extras, they are the difference between slow decline and sustained independence. The key principle is consistency. Small, specific actions compounded over time create measurable outcomes. You are not at the mercy of genetics. Your choices interact with your blood type's strengths and vulnerabilities. By understanding the biology, you can mitigate risk and improve longevity. This approach turns statistical predisposition into a practical roadmap. Knowledge without action changes nothing. Action without knowledge is inefficient. Combining both transforms aging into a controllable process. Your blood type provides insight into hidden vulnerabilities. It predicts areas where vigilance matters most. Use it to guide doctor conversations, dietary decisions, physical activity, and preventative testing. Regular check-ins, lab monitoring, and type-specific interventions allow you to intervene before minor issues escalate into major events. This proactive, informed approach is your best defense against age-related disease and a pathway to longer, healthier, and more independent living. The final takeaway: your blood type is a map of your biology. Your decisions are the tools you use to navigate that map. By knowing your type, understanding risks, and acting with precision and consistency, you can maximize health span and quality of life. Do not wait for symptoms to force awareness. Use this knowledge now to guide every decision: what to eat, how to move, how to manage stress, and how to monitor your body. Your longevity, independence, and cognitive function depend on these informed choices. In addition to type-specific interventions, a universal principle applies: regular movement, proper sleep, and balanced nutrition. Even small daily efforts compound over months and years to create measurable health benefits. For example, daily walks, resistance exercises, or gentle yoga improve circulation, muscle strength, and joint stability. These habits interact with your blood type profile to amplify resilience. Mental engagement also matters. Cognitive challenges, social interaction, and lifelong learning help maintain brain health, especially for type AB individuals who face unique microvascular risks. Meditation, breathing exercises, and consistent stress management enhance outcomes across all blood types by reducing cortisol levels and systemic inflammation. Hydration and gut health are often overlooked but are critical. For type O and type B, maintaining healthy gut microbiota directly impacts nutrient absorption and immune response. Fermented foods, prebiotics, and fiber-rich vegetables support this system, enhancing overall health and supporting longevity. Monitoring key biomarkers like blood pressure, cholesterol, fasting glucose, homocysteine, and CRP allows early detection of subtle changes. This enables interventions before small issues become major health events. Combine this with type-specific dietary adjustments: eggs and fermented foods for type O, stress reduction and folate-rich foods for type A, anti-inflammatory foods for type B, and DHA-rich fish for type AB. Finally, mindset matters. Understanding your blood type is empowering, not deterministic. Use this knowledge to guide decisions, to be proactive rather than reactive, and to treat your body with the precision it deserves. Each choice reinforces your biology's strengths, mitigates vulnerabilities, and creates a foundation for independence, longevity, and quality of life. Remember, your blood type is a map. Your actions are the path. Navigate it wisely, consistently, and with intention, and you will maximize your health span and preserve your vitality for decades to come. In addition to type-specific and universal strategies, it is essential to create daily routines that integrate your blood type insights. For instance, meal timing, portion control, and nutrient synergy can profoundly impact how your body responds to aging. Eating protein evenly distributed throughout the day supports muscle maintenance, particularly for type O and AB individuals who are at higher risk of sarcopenia. Stress management remains non-negotiable. Chronic stress amplifies vulnerabilities in type A and type AB blood types. Incorporating brief mindfulness sessions, diaphragmatic breathing, or light meditation for 10 to 15 minutes daily reduces cortisol and improves vascular health. Even a short walk outside, sunlight exposure, and engaging socially with friends or family offer compounding benefits. For cardiovascular resilience, monitor your key metrics actively. Blood pressure, resting heart rate, cholesterol panels, and fasting glucose are all actionable data points. For type A and type AB, focus on early detection of minor fluctuations. Small changes in blood pressure or inflammation markers are often the first signs that intervention is needed. Exercise is another cornerstone. For all blood types, resistance training 2 to 3 times per week and moderate aerobic activity daily optimize muscle retention, joint integrity, and cardiovascular efficiency. For type O individuals, high-intensity interval walking or bodyweight exercises help maintain metabolic balance. For type B, sustained moderate exercise like cycling, swimming, or brisk walking helps regulate inflammation and maintain glucose homeostasis. Hydration, gut health, and sleep synergize with these interventions. Maintaining adequate fluid intake ensures blood viscosity and cellular transport operate optimally, particularly important for type O and B. Consuming fermented foods, soluble fibers, and prebiotics supports microbiome diversity, which improves nutrient absorption, immune function, and even cognitive outcomes. Sleep hygiene, consistent bedtimes, 7 to 8 hours of restorative sleep, and limited exposure to blue light before bed reinforces all the other interventions, especially for type AB individuals who are more vulnerable to microvascular cognitive decline. Finally, personalization is key. Your blood type is a map of potential risks and strengths, but lifestyle choices, environment, and consistency determine how effectively you navigate that map. By combining type-specific nutrition, regular physical activity, stress control, gut and sleep optimization, and proactive monitoring of biomarkers, you can reduce risks, maximize resilience, and maintain independence far beyond what is statistically expected for your blood type alone. The power of this knowledge lies not in fear, but in proactive action. Every day you apply these principles, you are reshaping your trajectory, protecting your heart, your brain, and your overall health. Start small, stay consistent, and let your blood type guide your choices, not limit them. In addition to the type-specific guidance, there are several universal strategies that everyone can benefit from, regardless of blood type. Nutrition, exercise, and lifestyle habits all interact with your unique biology to either accelerate or slow down the aging process. First, focus on anti-inflammatory foods. Fresh vegetables, fruits, nuts, seeds, and fatty fish provide critical micronutrients, antioxidants, and omega-3 fatty acids. Chronic inflammation accelerates tissue degradation, vascular stiffening, and cognitive decline, and it interacts differently with each blood type. Minimizing ultra-processed foods, refined sugars, and seed oils reduces this inflammatory load, particularly for type B and AB individuals who are more sensitive to dietary triggers. Second, movement is essential. Daily activity is non-negotiable. For type O, resistance exercises and higher intensity movements stimulate metabolism and muscle strength. Type A benefits from moderate aerobic activity combined with flexibility work to counteract cortisol-driven cardiovascular stress. Type B thrives with consistent moderate intensity activity to maintain immune balance and prevent low-grade systemic inflammation. Type AB individuals should combine aerobic and resistance work to protect both brain and cardiovascular health simultaneously. Third, sleep and circadian rhythm management are critical. Aim for 7 to 8 hours of uninterrupted sleep each night. This allows the body to repair tissues, regulate hormones, and maintain immune function. For type AB, sleep has an outsized impact on cerebrovascular health. So prioritizing bedtime consistency, limiting screen exposure, and creating a calm pre-sleep environment is essential. Hydration and gut health also play major roles. Proper fluid intake supports circulation, joint health, and nutrient transport. Fermented foods and high-fiber vegetables maintain a diverse and resilient gut microbiome, which improves nutrient absorption, supports immunity, and indirectly strengthens muscles. This is particularly important for type B and AB individuals, whose immune systems are more influenced by gut flora composition. Fourth, stress management is critical for longevity and quality of life. For type A, cortisol reduction is a form of direct cardiovascular protection. For type O, it maintains metabolic and digestive balance. For type B, it prevents immune overactivation. And for type AB, it supports cognitive and vascular integrity. Daily practices such as mindful breathing, meditation, short walks, or journaling provide measurable benefits when done consistently. Fifth, regular health monitoring allows proactive interventions. Blood pressure, blood sugar, cholesterol, homocysteine, CRP, and other biomarkers help track how your body is aging. Tailoring checkups and lab tests according to your blood type ensures that you detect risks early and act before they escalate. For example, type O individuals should test for H. pylori, type A should track cardiovascular and stress markers, type B should monitor inflammatory biomarkers, and type AB should focus on cognitive and microvascular health. Finally, consistency is the ultimate multiplier. Knowledge alone is insufficient without action. Applying blood type-specific strategies in your daily routine, combined with universal anti-aging practices, balanced nutrition, strength training, aerobic activity, sleep optimization, stress reduction, and proactive health monitoring, can meaningfully alter the trajectory of your health. Your blood type is a map, not a destiny. Understanding it empowers you to take targeted action that strengthens your heart, your brain, your immune system, and your muscles. The small, consistent steps you take each day accumulate over weeks, months, and years, producing dramatic improvements in mobility, energy, resilience, and quality of life. The gap between genetic risk and health outcome is filled entirely by the choices you make consistently, and that is where your power lies. Now take a moment and reflect on what you've learned. Identify one actionable step you can take today based on your blood type. Start there. One small action repeated consistently is the most effective way to reshape your health trajectory and ensure longevity, vitality, and independence in your later years.